Let's break down the Federal Motor Carrier Safety Regulations. Part 40, Subpart A, Sections 401, 403, 405, and 407. Section 401, Purpose. This part outlines procedures for transportation industry employers and service providers regarding drug and alcohol testing. Example, imagine you're a truck driver. This rule ensures your company can test you for drugs, alcohol safely and fairly if needed. Consequences for violating Section 401. Carrier, fines, up to $11,000 per violation, loss of DOT operating authority, or increased insurance costs. One driver, job loss, disciplinary action, or required substance abuse treatment. Section 403 definitions. Key definitions include alcohol, ethyl alcohol, ethanol. ADOT, Department of Transportation. HAS, Department of Health and Human Services. Service provider, companies doing drug, alcohol testing. Example, if your trucking company hires a lab to test your urine, that's a service provider. Consequences for violating Section 403. Fines, testing invalidation, or compliance audits. Driver, potential retesting, disciplinary action, or impact on employment. Section 405 applicability. These regulations apply to employers and employees in DOT-regulated industries, e.g., FMCSA for trucking. Example, if you drive a big truck across state lines, your company must follow these rules. Consequences for violating Section 405. Carrier, penalties, fines, up to $11,000 plus per violation, operating restrictions, or loss of authority. Driver, job loss, suspension of driving privileges, or mandatory substance abuse evaluation. Section 407. Who conducts DOT drug and alcohol tests? Tests must be conducted by medical review officers, MROs, for drugs, and breath alcohol technicians, BATs, for alcohol. Example, if you need a drug test, a doctor, MRO, reviews it. For a breathalyzer, a trained BAT does the test. Consequences for violating Section 407. Carrier, fines, invalidated tests, or increased compliance scrutiny. Driver, potential retesting, disciplinary action, loss of driving privileges, or job loss. Subpart B, employment responsibilities, Sections 4011-4035. This subpart explains what employers must do to comply with DOT drug and alcohol testing regulations. Section 4011. Who is responsible for implementing these regulations? Employers are responsible for implementing DOT drug/alcohol testing rules for safety-sensitive employees, like truck drivers. Example, a trucking company must ensure its drivers follow DOT testing rules. Consequences for violating Section 4011. Carrier employer, fines, up to $11,000 plus per violation, loss of operating authority or compliance audits. Driver employee, potential job disciplinary action, suspension, or termination. Service provider, potential loss of contract or certification if involved in violation. Section 4013. What must employers do to comply? Employers must follow DOT agency rules, have a written policy, and designate a person to oversee testing. Example, a company creates a policy outlining when drivers are tested for drugs, alcohol. Consequences for violating Section 4013. A carrier employer, fines, increased compliance scrutiny, or operational restrictions. Designated employer representative, a DER, potential personal liability or job impact. Service provider, contract issues if non-compliant. Driver employee, NA, Section 4015. Do employers need to notify drivers? Yes. Employers must tell drivers about DOT testing requirements before testing. Example, a trucking company informs drivers they'll be tested randomly. Consequences for violating Section 4015. Carrier employer, fines or testing delays. Driver employee, potential impact on testing validity. Service provider, NA, Section 4025. What must employers include in their policy? Policies must cover testing circumstances, substances tested, consequences of refusal, and more. Example, a company's policy says drivers refusing tests face disciplinary action. Consequences for violating Section 4025. Carrier employer, fines, non-compliance findings, or operational restrictions. Driver employee, potential disciplinary action if policy unclear or violated. Service provider, potential contract issues if policy inadequate. Medical review officer, MRO, potential liability if involved in violation. Subpart C, responsibilities of service providers. Sections 4031, 40113. This subpart explains what service providers like labs, MROs, BATs must do to comply with DOT drug and alcohol testing regulations. Section 4031. Who is responsible as a service provider? Service providers, labs, MROs, BATs, etc., must follow DOT rules for testing procedures. Example: a lab must follow DOT rules when testing driver urine samples. Consequences for violating Section 4031. Service provider: fines, loss of certification, or contract termination. Carrier employer: potential fines or testing delays if provider fails. Driver employee: potential impact on test results or employment. MRO: potential liability if involved. Section 4033. What training must service providers have? Service providers, like BATs, MROs, need specific training and certification. Example: a BAT must be trained to conduct breath alcohol tests. Consequences for violating Section 4033. Service provider: fines, loss of certification, or contract issues. Carrier employer: potential compliance issues. Driver employee, NA. Section 4035. What are the responsibilities of an MRO? MROs review drug test results and handle certain procedures. Example: an MRO reviews a positive test and contacts the driver. Consequences for violating Section 4035. MRO service provider: fines, loss of certification, or liability. Driver employee: potential impact on employment. Subpart D. Collector responsibilities, Sections 4041-4073. This subpart explains what collectors, those taking urine samples for drug tests, must do to comply with DOT regulations. Section 4041. Who is qualified to collect urine specimens? Collectors must be trained and follow DOT procedures. Example: a nurse at a testing site collects urine samples following DOT rules. Consequences for violating Section 4041. Collector, service provider: fines, loss of certification, or contract issues. Carrier employer: potential compliance issues or testing delays. Driver employee: potential impact on test validity. Section 4043. What are the requirements for collection sites? Sites must have procedures to ensure sample integrity and privacy. Example: a collection site ensures the bathroom is secure for sample collection. Consequences for violating Section 4043. Collector site, service provider: fines or contract issues. Carrier employer: potential compliance issues. Section 4045. What are the collection procedures? Collectors follow specific steps for urine collection, like checking IDs, explaining procedures. Example: a collector checks a driver's ID before taking a sample. Consequences for violating Section 4045. Collector, service provider: fines or contract issues. And driver employee: potential retest or impact on employment. Section 4047. What are the requirements for the CD box? Collectors split samples into two containers, A and B. Example: a collector splits a urine sample into two bottles. Consequences for violating Section 4047. Driver employee: potential impact on test results. Let's dive into Subpart F of Part 40, which outlines the administrative provisions for drug and alcohol testing. Subpart F, Drug Testing Laboratories, Sections 4081-40113. This subpart explains the requirements for labs testing DOT drug samples. Section 4081, who may conduct DOT drug tests? Only HHS-certified labs can test DOT samples. Example: a certified lab tests a urine sample for a trucking company. Consequences for violating Section 4081. Lab, service provider: fines, loss of certification, or contract issues. Carrier employer: potential compliance issues. Driver employee: potential impact on test results. Section 4083. What are the lab responsibilities? Labs must follow DOT procedures for testing and reporting. Example: a lab reports a positive test result to the MRO. Consequences for violating Section 4083. Driver employee: potential impact on employment. Section 4085. What are the requirements for lab reports? Labs report results to MROs, who handle driver notifications. Example: a lab sends a report to an MRO for review. Consequences for violating Section 4085. Lab, service provider: fines or contract issues. MRO: potential liability if involved. Administrative provisions, Section 4091. Labs must maintain chain of custody and documentation. Labs must report results accurately and timely to MROs. Non-compliance can lead to fines, loss of certification, or contract termination. Example, a lab fails to maintain proper chain of custody, so the test is invalidated. Consequences for violating Section 4091. Subpart E, Urine Specimen Collections, Sections 4051-4073. This subpart explains the steps for collecting urine samples for DOT drug tests. Section 4051. What are the requirements for the collection process? Collectors must follow specific steps, like checking IDs, explaining procedures, ensuring privacy. Example, a collector checks a driver's ID and explains the collection process. Consequences for violating Section 4051. Collector, service provider. Fines or contract issues. Carrier, employer. Potential compliance issues. Driver, employee. Potential retest or impact on employment. Section 4053. What are the requirements for specimen handling? Samples must be handled securely and shipped correctly to labs. Example, a collector seals and ships a urine sample to a lab. Consequences for violating Section 4053. Driver, employee. Potential impact on test results. Section 4055. What happens if a specimen is dilute? If a sample is dilute, the employer may require a retest. Example, a driver's sample is dilute, so the employer requires another test. Consequences for violating Section 4055. Carrier employer. Potential compliance issues if not handled correctly. Subpart G. Medical review officers and the verification process. Sections 40121, 40169. This subpart explains MRO responsibilities in reviewing and verifying drug test results. Section 40121. Who is qualified as an MRO? MROs must be licensed physicians with specific training. Example, a doctor serves as an MRO for a trucking company. Consequences for violating Section 40121. MRO, service provider. Fines, loss of certification, or liability. Carrier employer. Potential compliance issues. Driver, employee. Potential impact on employment. Section 40123. What are the MRO responsibilities? MROs review lab results, handle positives, and contact drivers. Example, an MRO contacts a driver about a positive test. Consequences for violating Section 40123. Section 40125. What must MROs do with lab results? MROs verify results. Check for legitimate medical explanations. Example, an MRO verifies a positive test due to no valid prescription. Consequences for violating Section 40125. MRO, service provider. Fines or liability. Subpart H, split specimen tests, Sections 4011, 40189. This subpart explains what happens when a driver requests a split specimen test after a positive result. Section 4071. What is a split specimen? A split specimen means the original urine sample is divided into two containers, A and B. Example, a driver tests positive. They can request container B be tested. Consequences for violating Section 40171. A lab, MRO, service provider. Potential issues if procedures are not followed. Carrier employer, potential compliance issues. Driver employee, impact on employment if positive. Section 40173. How does a driver request a split test? Drivers must request in writing within 72 hours of MRO notification. Example, a driver requests a split test after getting a positive result. Consequences for violating Section 40173. Driver employee, missed deadline means no split test. MRO lab, potential issues if request mishandled. Section 40175. What happens if the split test is negative? If split B is negative, the test is canceled. Example, split B is negative. Driver's job is not impacted. Consequences for violating Section 40175. Lab, MRO. Potential liability if error caused issues. Carrier, employer. May need to reinstate driver. Driver employee. Job impact reversed if applicable. Section 40177. What if the split can't be tested? If split B can't be tested, the original result stands. Example, split B is unavailable. Original positive stands. Consequences for violating Section 40177. A lab MRO. Potential issues if procedures are not followed. Driver, employee. Potential impact on employment. This subpart ensures drivers have a way to challenge positive results. Summary. Drivers can request split tests for positives. Requests must be in writing within 72 hours. Split test results impact employment outcomes. Subpart Y. Problems with urine collections. Sections 40191, 40209. This subpart explains what happens when issues occur during urine collections for DOT tests. Section 40991. What is an invalid result? An invalid result means the lab can't confirm if drugs were present. Example: a sample is too diluted, so it's declared invalid. Consequences for violating Section 40191. House lab, service provider, potential issues if too many invalids occur. Carrier employer, may need retest. Driver employee, potential retest required. Section 40193. What if a specimen is substituted or adulterated? If a sample is substituted, adulterated, it's a refusal to test. Example: a driver tries to cheat. It's treated as a positive. Consequences for violating Section 40193. Driver employee, likely job loss or consequences. Carrier employer, must report refusal. MRO, reviews results. Section 40195. What if a collection is canceled? If a collection is canceled, it's like it didn't happen, usually. Example: a collector error cancels the test. Driver retests. Consequences for violating Section 40195. Collector, service provider, potential issues if errors cause cancellations. Driver employee, usually retests. Section 40197. What if there's a direct observed collection? Direct observation may happen if a sample is suspicious. Example: a driver must retest under observation. Consequences for violating Section 40197. Driver employee, potential impact on privacy stress. Carrier employer, must follow rules. Subpart J, alcohol testing personnel, Sections 40211, 4021. This subpart explains requirements for breath alcohol technicians, BATs, and screening test technicians, STTs. Section 40211, who conducts alcohol tests? BATs, STTs must be trained and follow DOT rules. Example: a BAT conducts a breath test for a trucking company. Consequences for violating Section 40211. BATS TT, service provider, fines, loss of certification. Carrier employer, potential compliance issues. Driver employee, potential impact on test results. Section 40213. What are BATS TT responsibilities? BATS STTs follow procedures for breath tests. Example: a BAT explains the test to a driver. Consequences for violating Section 40213. BATS TT service provider, fines or certification issues. Subpart K, testing for alcohol, Sections 40225, 40245. This subpart covers breath test procedures. Section 40225, how is an alcohol test done? BATs follow specific steps for breath tests. Example: a driver blows into a breathalyzer. Consequences for violating Section 40225. BAT, service provider, potential issues if errors occur. A driver, employee, potential impact on employment. Subpart N, MRO review of alcohol test results. Sections 40261, 40269. This subpart explains how MROs handle alcohol test results. Section 40261. What are the MRO responsibilities for alcohol tests? MROs review results and handle positives, negatives. Example: an MRO reviews a 004 confirmation test result. Consequences for violating Section 40261. MRO, service provider, potential liability if errors. A carrier employer, compliance issues if mishandled. Driver employee, job impact if positive. Section 40263. What if a driver disputes an alcohol test? Drivers can dispute results. MRO reviews. Example: a driver disputes a 004 result. MRO investigates. Consequences for violating Section 40263. MRO, service provider, potential issues if not handled right. Driver, employee, job impact if upheld. Subpart O, substance abuse professionals. Sections 40281, 40313. This subpart covers SAP roles in return-to-duty processes. Section 40281. Who is a substance abuse professional? SAP. SAPs evaluate drivers after positives or refusals. Example: a driver sees SAP after a positive test. Consequences for violating Section 40281. SAP, service provider, potential liability if errors. Driver employee, must follow SAP plan for return to duty. Section 4283. What is the SAP's role? SAPs create return-to-duty plans for drivers. Example: a SAP requires treatment before return to duty. Consequences for violating Section 40283. Driver employee, must comply with SAP plan. Carrier employer, must follow DOT rules for return to duty. Subpart P, confidentiality and release of information. Sections 40321, 4033. This subpart explains how DOT handles confidentiality and info release for drug alcohol tests. Section 40321. What are the confidentiality rules? Test results are confidential. Release needs consent except as required by law. Example: an employer can't share test results without consent. Consequences for violating Section 40321. Service provider employer. Fines, liability, or lawsuits. The driver's employee. Potential privacy impact. Section 40323. When can info be released? Info can be released with written consent or as law requires. Example: a driver consents to release results to their employer. Consequences for violating Section 40323. Service provider employer. Potential issues if mishandled. The driver employee. Privacy impact if unauthorized release. Section 40325. What about access to records? Employers must keep records secure. Limited access. Example: only HR accesses test records. Consequences for violating Section 40325. Employer. Fines or compliance issues. Driver employee. Potential privacy impact. Let's dive into Subpart Q of Part 40, which outlines the procedures for role fitness for duty. Subpart Q. Role of state and local governments. Sections 40401, 40405. This subpart explains state and local governments' role in DOT drug alcohol testing. Section 40401. Can states' local governments require tests? States' local governments can't change DOT rules for covered employees. Example: a state can't lower DOT's 004 limit for CDL drivers. Consequences for violating Section 40401. State, local government. Potential federal funding issues. Carrier-employer. Compliance issues if conflicting rules. Section 40403. How do DOT and states interact? DOT rules preempt conflicting state-local laws. Example: DOT rules override local laws for trucking companies. Consequences for violating Section 40403. A state-local government. Potential preemption issues. The carrier-employer must follow DOT rules. Subpart R. Public interest exclusion. Sections 40401, 40413. This subpart covers excluding service providers for non-compliance. Section 40401. What is a public interest exclusion? PIE. PIs exclude service providers like labs for violations. Example: a lab certification is suspended, gets a PIE. To service provider, loss of business, certification. But carrier/employer. Potential compliance issues. Subpart S. Management Information System. Sections 40421, 40429. This subpart explains MS reporting requirements for employers. Section 40421. Who must report missed data? Employers with DOT-regulated employees must report annually. Example: a trucking company submits missed data to DOT. Consequences for violating Section 40421. Employer. Fines or compliance issues for non-reporting. Service provider. Potential issues if data mishandled. Section 40423. What data is reported in miss? Data includes of tests, positives, refusals. Example: an employer reports 100 tests with 2 positives. Consequences for violating Section 40423. Employer. Potential fines for inaccurate, incomplete data. Service provider. Issues if data errors. Section 40425. How is missed data used? DOT uses data for oversight compliance checks. Example: DOT reviews missed data for audit purposes. Consequences for violating Section 40425. Employer. Compliance checks, audits may increase. Service provider. Potential scrutiny. Let's look into Subpart T of Part 40, which outlines the procedures for compliance and enforcement. Subpart T. Compliance and enforcement. Sections 40431, 40441. This subpart explains DOT's approach to enforcing Part 40 rules. Section 40431. How does DOT conduct inspections? DOT can inspect employers, labs, MROs, etc. Example: a DOT inspector audits a trucking company's testing records. Consequences for violating Section 40431. Employer or service provider. Fines, penalties if violations found. PID driver, employee. Potential impact if issues affect job. Section 4043. What are the penalties for non-compliance? Penalties include fines, loss of operating authority. Example: a company faces fines for missing DOT testing rules. Consequences for violating Section 40433. Employer service provider. Fines, loss of business. Driver employee. Job impact possible. Section 40435. Can employers face implied consent? Employers must comply with DOT rules as a condition of operating. Example: a trucking company must follow Part 40 to keep operating authority. Consequences for violating Section 40435. Employer. Potential loss of authority for non-compliance. Appendices to Part 40. These appendices provide details on procedures, forms, and model plans. Appendix A. DOT Drug Testing Semi-Annual Lab Report. Labs report testing data to DOT semi-annually. Example. A lab submits data on hour of tests, positives. Consequences for violating Appendix A. Lab service provider. Potential issues if data is late, inaccurate. Employer. Compliance checks may increase. Appendix B. DOT Medical Review Officer, MRO, Guidelines. Guidelines for MROs handling test results. Example. An MRO follows guidelines for verifying positives. Consequences for violating Appendix B. MRO, service provider. Potential liability if errors. Driver employee. Job impact if MRO issues affect results. Appendix C. DOT Substance Abuse, Professional, SAP Guidelines. Guidelines for SAP evaluations and return to duty. Example. A SAPI follows guidelines for driver treatment plans. Consequences for violating Appendix C. SAP, service provider. Potential issues if non-compliant. Driver employee must comply with SAP plan. Let's dive into more appendices of Part 40. Appendix D. DOT Employer Drug and Alcohol Testing, Missed Data Collection Form. Employers use this form for annual misreporting. Example. A trucking company submits missed data using this form. Consequences for violating Appendix D. Employer. Potential fines if form is incomplete, incorrect. Service provider. Issues if data mishandled. Appendix E. Drug testing. Custody and control form. CCF. The CCF tracks urine sample handling. Example. A collector fills out the CCF for a driver's test. Consequences for violating Appendix E. Collector. Service provider. Potential issues if CCF errors. Driver employee. Potential impact of CCF issues. Appendix F. Alcohol testing form. Used for breath alcohol tests. Example. A BAT uses this form for a driver's test. Consequences for violating Appendix F. BAT. Service provider. Potential issues if form errors. A driver employee. Potential impact if issues affect results. Appendix G. SAP report format. SAPs use this format for employer reports. Example. A SAP sends a report to an employer. Consequences for violating Appendix G. SAP, service provider. Potential issues if report non-compliant. We've covered subparts AT and appendices of FMCSA Part 40, covering procedures for drug alcohol testing, roles of employers, MROs, SAPs, labs, confidentiality, MIS reporting, enforcement, forms and guidelines. Key takeaways for employers' drivers. Follow DOT rules for testing, reporting, and confidentiality. Understand consequences for violations, fines, job impact. Use proper procedures for collections, MRO reviews, and return to duty.